What's up, everybody? My name is Alex. I am your host here on the Swole Friends podcast, as well as a co-founder and COO here at Swolverine. Swolverine is an endurance athlete and active lifestyle brand. We have over 31 different products, from performance powders all the way to daily health supplements that are all proprietary, blend-free, clinically dosed, and scientifically proven effective. We also offer one-on-one nutrition coaching, training templates, and online personal training, as well as some competitive fitness programming, which is a new service offering here for us at Swolverine. But that's not what we're here for. We are here, tune into the Swole Friends podcast. And today we have episode 22. We're over that 20 mark, and I'm so excited. Thank you to all of our listeners and watchers. And today we are joined by Karmen Gregg. She is a Ph.D. candidate, clinical nutritionist, a co-founder of Selkirk Women's Health, which is an integrative women's medical clinic in Coeur, Idaho. So up there on the Panhandle, it's beautiful. You guys ever get a chance to go visit. Karmen is also an adjunct professor at the Great Northwestern or Northern University. Mm-hmm. So in this episode, recorded live on YouTube, and we will post this too, if you're listening, on Spotify and Apple Podcasts. We're talking all about optimizing training with menstrual cycle, fueling for hormonal balance with exercise, how to take performance as a female athlete specifically to the next level. So our male listeners, we do apologize. We're going to take a little bit of a different focus and go directly to women today. But if you're a coach or someone in the fitness space, I would say that this podcast is definitely important for you to listen to so that you can provide better services and empathy too for your female athletes, because we have so much fluctuation throughout the month. So I will stop talking, but Karmen, oh my gosh, it's so excited to have you on the podcast. Welcome. How's everything going so far?
Good. Thanks so much, Alex. That was such a nice intro. I always feel like people always, that makes you sound cooler than you are, for sure, when people say your credentials for that. But I'm doing great over here. It's a really beautiful, we finally don't have snow. We had a half a foot of snow 2 weeks ago. Here up in Idaho. So it's nice that it's sunny. So it's a good Thursday for sure.
Good. And you are in the clinic. The clinic just opened like recently, right?
Yeah. So we started Selkirk Women's Health. I own it with my co-founder, who's a nurse practitioner, Jordan Watts. So we opened it technically in October. And we were still kind of transitioning. It's really hard to find commercial space here in Coeur. And so we're like, well, we feel like we want to start the clinic. So we started it just doing telehealth. And then we just got our clinic space. It's the first week. So I'm in our conference room. We opened on Monday. So it's really exciting. So we started, it's 5 months old, which is wild. But, we felt like at, 31 years old, we were like, you know what, women need better clinicians and we can't find them. So I guess we need to try and create the clinical practice we think that they need. And so we just see women. And I know that you said males, this isn't your episode, but it definitely is if you care anything about women, which hopefully all guys do. And I'll talk a little bit about the differences with women and men when it comes to hormones and feed a little bit into that. But yeah, we just see women. So I used to see men. I've been a nutritionist, dietitian for 10 years. And, I saw guys and it just wasn't my thing. I mean, they're great, but I can't resonate with them as much as women. And the majority of my patients my whole career have been women. So I felt like let's just niche down and serve the population that I'm most passionate about and help them. So, yeah. So Selkirk Women's Health just opened.
Awesome. And so you have, you can go into the sport focus with women. You can go into clinical. I know you mentioned when we were talking previously, like your focus is prenatal. Can you tell me a little bit more about what type of, integrations you work within or work under?
So, so it's kind of evolved. I think like everybody in their career, you just kind of evolve with the needs as you see. So I thought I was going to be a sports nutritionist coming out of my undergrad. I went to University of Idaho and thought like, I really want to work with a hockey team. Now I look back and I'm like, what on earth was it? I love hockey, but, and then got into the workforce and started seeing a lot of needs within women's health. Went back and got my master's in nutrition and really focused on thyroid function in my master's. I did my master's thesis on Hashimoto's thyroiditis. So we can talk a little bit about how prevalent thyroid issues are, especially in athletes and women's health in general, and how that affects performance. And then when I started to go for my PhD, I started to see this big need that women postpartum during pregnancy and trying to get pregnant, there was literally no one serving them from a nutritional perspective. And so I kind of veered into that. And so that's what I've kind of known for in the areas. Like if you want to get pregnant, if you want to have a really great pregnancy, if you want to recover really well, like I'm probably your girl. But doing that, you have to know hormones incredibly well. And so when you know hormones really well, you can understand, okay, what's the best way and how do we work with our menstrual cycle instead of against it? There's also a big lack of scientific literature that has specialized in women's health. Mm-hmm. So the majority of research, especially when it comes to athletes, is done on male participants, mm-hmm. which sucks because the recommendations that they're getting is for males. And males have a 24-hour hormone cycle. Their testosterone is high in the morning and then slowly goes down. We have a 28-day cycle and have a lot more hormonal fluctuation to deal with. And so when we're giving these blanket statements for athletes, or whether that be for training or nutrition or anything along those realms, and it's for a male and we're trying to implement it, we're going to have a different result. And then a lot of times what I see is women get frustrated. They're like, well, I went keto and my husband lost 20 pounds and I've gained 5 and, and feel terrible, or, I've been doing endurance training and I feel like crap. And, but my male counterparts are thriving, or, especially like in CrossFit, like women need a little bit more recovery time, or there's different times where you could get injured more likely, or would be better to PR during your menstrual cycle. And so I feel like I just continually saw a need and didn't really have a strategy. I never thought I'd become a doctor. But I felt like the more education, the further along I got, the more I felt like I should just go for it. And I think a lot of times people get pretty intimidated by going for a doctorate. It is intimidating. It's a ton of hard work. I'll be finished in August, hopefully. Mm-hmm. But I think when you see that there's a need and you're not sure if someone else is going to fill it in the world, a lot of my students and at the university I teach for, they're like, Ms. Gregg, I want to be a doctor. And I'm like, well,
not going to discourage you.
Like spend 7 years of your life. It's fine. But I mean, I think if you truly believe that work won't get done, like it's yours to do. And that's kind of what I felt like called me to do that. And then when you talk about hormones, you get to relate with all women. And so that's in our practice. I might be working with someone that's perimenopausal, menopausal, postmenopause, trying to get pregnant. But once you understand the role of hormones, it's easy to apply to all women, regardless of kind of their goals, whether they're an athlete, whether they're just trying to be a mom and move really well and lose a little weight. It just kind of depends. So that's kind of the evolution of where that came to be.
Well, yeah. And there's a lot of overlap, right? And keeping it simple and straightforward, like there's some basic practices and basic, applications within nutrition and fitness and training and just women that I think that the internet likes to overcomplicate, and like we start to get influencers and we start to get people who see that they can make a lot of money off of like preying on people's insecurities or contributing to diet culture. Like, oh, I'm a hormone specialist because I did this month-long certification online during COVID. You're like, oh, okay, no. But you mentioned this kind of quote that, typically the professionals are the ones who are the quietest, right? And so that's a really big benefit of this type of episode, like for our listeners or for our community. And why we wanted to have you on is because, it's not like you have 800,000 followers, but you do have this knowledge base and this expertise that a lot of people are going to be able to benefit from. And the more that we can get, appropriate information out there, scientifically backed information out there through the Swolverine platform, like that's what we want to have happen, right?
Well, and I think you guys are always been really good with you and Walter and just like really focusing on evidence-based supplementation, dosaging, like all of that. I was really impressed the first time I met Walter, because of that, because it's not like, some, bro supplement line where it's like, oh, this doesn't have any research behind it. To me, research is how we create change. And so that, to me, it's like when people are more educated, like the world becomes a better place, regardless of where they're getting educated in any realm when it comes to, health and wellness. I think when people are healthier, they're better people because they feel good. And so I think, bringing that level of education, and us academics, we don't like to be out in front. Like we might like present our research at a conference that like no one's heard of. But I also value that it's, anytime that I've thought, I don't have a problem speaking in front of people, but when people are like, I used to, and I thought, well, that's a disservice because I'm doing all of this work and all this research and no one would know about it except the people that are, need fertility or prenatal work. So it's important to me to help educate the greater community and that. So.
Yeah. Well, it's awesome. Well, let's dig in. Where do we start? Oh, there's so many exciting places to start. But go ahead.
I was going to say, do you want to start? I can explain the menstrual cycle because I feel like
okay.
Most of the time,
right? Let's start with the basics.
And it's so funny, Alex, because I'll think, well, that's the basics. Like everybody, like all women, they know their period. Oh my Lanta, like the amount of women that are postmenopausal and they're like, there's different phases of our menstrual cycle. And I'm like, I'm going to have to go into like elementary schools here soon. But so we can start with the menstrual cycle and then talk about the different hormonal fluctuations and what you can do to optimize and with that. So day one is the day your period starts. A lot of people don't really know when they're tracking your period, like how they're tracking it or what's happening. Or if you're not tracking your period, please start tracking it. There's 1,010 different apps that you can use. But day one is the day your period starts. And that's called, your menstrual portion of your menstrual cycle. So you are usually bleeding for about 4 to 7 days. And then you move into what's called the follicular phase. So when you're during your menstrual cycle, all hormones, estrogen, progesterone, and testosterone are all relatively low. I'll talk about what those do in the body in a second, but they're all low. So you're just shedding your uterine lining. And then they start to go up when you get closer to ovulation, which is typically mid-cycle. So that's called the follicular phase. And you see a rise in estrogen is the predominant hormone that's rising during that time. Most women feel really great during this, like day 7 to day 14. That is the time, if you're an athlete, and the way I define an athlete is any woman that moves. And so if you're trying to do any performance goals, like this is the time in the gym where you want to PR. Like you feel the strongest. Estrogen makes you feel awesome. That's what helps maintain our lean muscle mass. It helps with cognition. It helps with bone density. It also makes us feel really great and is responsible for our boobs and butt. That's why when we start our period, that's why we get a little bit curvier. You also might have a higher libido. So you feel really great during this time, and we can optimize that. So if you're feeling, that nice estrogen surge, PR in the gym, do a long endurance run, like push yourself, whether that be physically or mentally. We're usually the most creative during this time. Our brain functions really well. So this is a great time in your cycle to start new projects. I always this is super nerdy, and that you're like a hormone researcher. When you do your creative projects during this time, a lot of times people will notice right before your period starts, you're kind of sluggish. You don't feel super great. That's, why work against your body? This is the time when you want to start that podcast, write that paper, start something new. You're going to feel really good. You're also going to feel really confident during that time. Men are most attracted to us during this time. With that surge in estrogen too. So when it comes to attraction level, it's, those pheromones. And then you move that mid-cycle, usually it just depends on the woman, day 14 through day 16, you're ovulating. So what does ovulation mean? It means that your ovaries release an egg. to then go get fertilized by sperm. So most of the time, if you were in your general sex ed class, if you were like me, I thought you could get pregnant every single day of your cycle. You can't. You've got this nice little window of about 24 to 48 hours where the egg can get fertilized. And, if it doesn't, then you continue on, and in 2 weeks, your period starts. So during ovulation, that egg releases. Your body also creates something called the corpus luteum, which secretes progesterone, which is the hormone. So estrogen drops off during ovulation and progesterone rises. So progesterone takes over the second part of your cycle called the luteal phase. During that phase, you're going to feel a little bit more worn down, a little tired. So the first week right after ovulation, you still might feel pretty okay. And then, as most women do, a week before their period, start to feel a little bit more sluggish, a little bit more fatigued, might have some irritability, some cramping, water retention, some of those general hormone symptoms. That's during the luteal phase. Those are common. That does not mean they're normal. That's my favorite thing. Dr. Jolene Brighton, she's one of my favorite naturopathic physicians. And she always says, just because something's common doesn't mean it's normal. Just because all you and your friends are complaining, like you have debilitating cramps and, you can't function and you want to rip your husband's head off like 3 days before your period starts. It shouldn't be that way. That's a sign of a hormonal imbalance. And so progesterone should be high during that time. And you shouldn't necessarily have a bunch of fluctuation kind of in your performance. You might feel a little more tired. You might be a little bit more hungry. You might need a little bit more rest, and you might be, from a psychological standpoint, a little bit more introverted during that time. That's normal. Progesterone, I call it your cool, calm, and collected hormone. It helps with circadian rhythm. It helps with mood regulation. It helps with fluid balance in the body. It helps maintain a pregnancy if you do get pregnant during the ovulation period. And then the luteal phase ends 2 weeks after you ovulate, and then it starts all over again. So that's kind of the menstrual cycle. During that luteal phase, when it comes to training and when it comes to nutrition, estrogen is really, really helpful for insulin sensitivity, which I'll explain a little bit more, and appetite regulation. So it's very common for women to eat on average between 200 and 800 additional calories during that phase of their cycle, and your metabolic rate is higher. So your body can take the impact of a little bit more food. It just varies based off of the person. You might notice yourself a little bit warmer or sweating a little bit easier during that time, or your heart rate, if you've got a Fitbit or an Apple Watch, is a little bit higher in the morning. Your metabolic rate is higher during that luteal phase. So it's okay to eat a little bit more. You might, with progesterone, you're a little bit more insulin resistant. Not that you're, from the pathophysiology of insulin resistance, but you might be craving carbs a little bit more. So choosing those higher fiber options like quinoa or sweet potatoes or beets, like the whole food options, and making sure you're eating enough protein and fat to stabilize your blood sugar could be helpful. And added need for magnesium during that time as well. So women crave chocolate during that time because cacao is the primary source of magnesium found in nature. So have some dark chocolate. So there's different things you can see during the different parts of the cycle that I feel like as women, we intuitively know, like, hey, we're a little bit hungrier. We're eating a little bit more during that time, or we're craving chocolate, or we notice, hey, that long run doesn't, felt really good a week ago, doesn't feel really good now. I think that women were created to be really intuitive, and we've been, through society and social media, have disassociated from our natural intuition when it comes to those different phases. And the more that we can know about those different phases and lean into them, not that, it's, you can't do a long run during your luteal phase, but more of, okay, I can push it when I need to, but if I have some flexibility with my training, why don't I work with my body instead of against it during this cycle, I guess I would say. So that's kind of a general overview. I don't know, Alex, any questions on that, or did I
Oh, I love it. I think you explain it very straightforward and in a very easy to comprehend way, whether you have a cycle or not. I mean, whoever is listening to this, to be honest, I think that a lot of times, so I do have some questions, but I think a lot of times people shy away from getting to know this because we weren't taught it. So I, for one, am someone who my parents didn't talk to me about this. Mom didn't talk to me about this. Education sort of talked about it, but just said if you sleep with a lot of people, you're just a slut and you're going to get a period. Like sophomore in high school, like what?
Or I hope I get a period, right? Like,
yeah, I'm like, oh my gosh. And so like a lot of people shy away from trying to figure out this information and learn the data. And the data, though, is what can set us free. It enables us to take control and to tap into that intuitiveness, like you're saying that we have. And it's nice what you're saying, too, for like a coach perspective, for example, to say, hey, like, I understand how your body works. Like, you're a woman, you're different. That's okay. There's nothing wrong with you. And then you're there as the athlete and you say, okay, I don't feel capable of pushing. It's not like something's wrong with me. It's just more so like I'm listening to my body. And then you both have this common understanding of like, hey, it's Wednesday. Training might not be at 100%. That doesn't mean we're not going to be productive. That doesn't mean we're not going to be successful today. And you don't have to walk away feeling lesser than your male counterpart, right? Or like, and I don't know, I assume I do this. So I assume other athletes do this. And then you kind of beat yourself up and you're like, oh, well, if I was this or I was that, when really it's honestly just a fluctuation in your body and your body's trying to tell you something and it's your job to listen. Right.
Yeah. And I think it just gives a lot of compassion for yourself. I feel like when it comes down to it, most people are not lazy. So if they're pulling back their training, or if you naturally intuitively go like, man, I'm just not feeling it today. Beating yourself up for that is not, number one. We know shame isn't a great motivator, but also it's like, oh, I'm, check your period app. Oh, my period starts in 3 days. Like that explains something, or, and so maybe instead of going on, a long trail run, I'm going to take a yoga class and infrared sauna and like take an Epsom salt bath along with that. And so I think for me, what I see with my patients, what I see with my students is that it gives them a lot of permission for them to be okay with who they are at the different parts during their month and know that they're not lesser than, and actually working with themselves will produce the most productive outcomes regardless. And so we've seen the negative associations with people trying to down regulate hormones. So it's very popular. I've worked with different universities and their athletes for athletic trainers to advise female athletes to be on birth control during season or just in general, because it just mutes everything. So there's no fluctuation in their body. So when people are on birth control, and we can talk about this a lot more if you would like, instead of people always think when you're on birth control, it's putting your body, faking it and to think that it's pregnant. It's actually putting it into a false menopause, which means that all hormone production is low. And so there's no hormonal fluctuation. So that's why a lot of times people will go, oh, all my hormonal issues, they went away when I went on birth control. And it's like, yeah, because it shut it all down. So athletic trainers, coaches, people like to put people on birth control because they can regulate it. Then it's not this spontaneous issue when you're training. It's like, oh, it's just flat. That's the other reason why a lot of female research participants are excluded, because they feel like our menstrual cycle is too much of a compounding factor when it comes to research outcomes. It's like, well, we have to equate for this menstrual cycle, this omnious menstrual cycle that 50% of the population has had. And so they just want to shut it all down, which we know that, in my opinion, it's our superpower, that we can really use this to our advantage in athletic performance when we can. And so, yeah, when you're more educated, it's not scary. You're not scared. Like, if you know your cycle, say you don't want to do hormonal birth control, but you're having sex, like, when you could get pregnant. Okay, 5 days before ovulation, maybe watch yourself a day after. Then after that, like, physiologically, it's impossible for you to get pregnant. So, or, oh, I'm having discharge at this time. Like, do I have a yeast infection or am I having cervical fluid? Like, so I think
a lot less panic in the world.
Yeah, it's a lot less panic. Then you go, oh, okay. And it's cool when you know a lot about your body, because then you feel really empowered, and this is how my body's functioning and it's doing what it can. And Alex, your experience with not getting information from school, your parents my mom is like, love her to death. She's incredible, but like never had these conversations. And then her daughter grew up to be a hormone doctor, and it's like, well, like we just had to take it to the extreme, as I do with everything. But like, most people are not getting this information. So your experience and mine is not unique. It's sad, but I think now more and more women are speaking out to say, hey, we want to know this information. We want to know about our bodies so we can self-advocate for ourselves and do what's best for our body, regardless of what society is telling us, or even doctors. I think that a lot of times the medical doctors like to do a medicalization of the female body, and it's just doing what it should. It doesn't need to be regulated. It does its own. So
yeah, it's like a liver cleanse, but we don't have to go there.
So we do a whole other thing. Do you want me to answer the question?
So we have this question. Yeah, we have, do the hormone fluctuations remain the same, just lower doses for those in peri and menopause? And then the next question was, and how does that change for people with a
hysterectomy? That's a great question. So with hormonal fluctuations, so once you start your menstrual cycle, you have, most girls are starting at between the ages of like 10 and 12. You have that 28 to 35 day cycle, those normal estrogen, progesterone. Testosterone kind of does its own small little peak right before ovulation, then goes down to until you get to about 35, 40. That's the typical perimenopausal state. That means you're not in menopause, but perimenopause can start 10 to 15 years before someone goes into full-blown menopause, and I'll define what that is. So in perimenopause, women can start as early as 35 and between 35 and 50. What that means is that hormonal fluctuation that's happening gets a little bit sporadic. And so most of the time, women have weird surges in estrogen or lower levels of progesterone. So they have like spotting during ovulation, or their cycles become shorter. That's what we call a luteal phase defect. So progesterone is going down. And so their cycle's getting shorter. It's getting more frequent or longer cycles. So typically estrogen starts to go up a little bit and progesterone starts to drop during perimenopause. And then when you get into menopause, menopause is defined as 12 consecutive months without a period. And what happens during menopause is your ovaries during your menstrual years up until menopause is the primary hormone production center of the body. So the ovaries are producing your estrogen, your testosterone, and your progesterone. There's other places in the body, but that's the predominant place. So during menopause, what happens is everything goes flat. So your ovaries, they're done producing those hormones. And what happens is during that transition, why women have such a hard time transitioning to postmenopause and some of the issues that pop up with that, and we can talk more about that, is that the adrenal glands are your glands that sit, there's two of them on top of your kidneys, and they release your stress hormones for the majority of your life. So your adrenaline and cortisol and some other hormones. And so during menopause and after, those are the glands that produce your estrogen and progesterone predominantly, but in such lower levels. So essentially all your hormones go way, way, way low. And that's normal. That's normal during menopause. And postmenopause is that you predominantly lose your hormone producing center, the ovaries, during that time. So, and then I think there was a second half to that question. Oh, how does that change for those with a hysterectomy? So when you get a hysterectomy, it depends. So there can be a partial where they just take the uterus out, or it can be a full hysterectomy where they take the ovaries. And that can be for a whole host of different reasons, potential cancer risk, different heavy bleeding or symptomology that's not congruent or affecting their quality of life. If you leave the ovaries, they still produce the estrogen and progesterone at their same rate up to a year, and then the production starts to go down. So most women go, okay, well, I got a hysterectomy at 35, but I didn't go into menopause till I was 50. Well, you might not have had menopausal symptoms till you were 50, those hot flashes, mood swings, weight gain, but your hormone production started to go down after year one. And not a lot of physicians talk about that. And so they're like, oh, I'm not going to do hormone replacement on you because we left your ovaries, so everything's going to be just fine. And it's not. And so, but if they take your ovaries, you're kind of forced into menopause at whatever age your hysterectomy was done. And then the other way that we diagnose or menopause is if you have an elevated FSH, follicular stimulating hormone, in your blood work. And that's the hormone that's released. That's the hormone that is released from the pituitary gland to stimulate ovulation, along with the luteinizing hormone. So that hormone goes high because your brain, actually, fertility, I always tell patients, starts in the brain, is that your brain keeps trying to send that signal like, hey, are we going to ovulate? And your ovaries are like, no. And so it feels like it's not getting the signal. So it sends more of that. That's why we see an elevated follicular stimulating hormone in menopause. And so that's kind of, if someone's had a hysterectomy and they don't have a period to tell them they've been period free for 12 months, we run an FSH and see where they're at with that. But it's really difficult in those years, I'll say, for the person that asked the question, to self-advocate for yourself to a physician, because they're going to tell you you're just fine and this is just normal. And there's lots of not just, inconveniences in your life quality during perimenopause and menopause, but long-term ramifications. If your estrogen is too low and your progesterone is too low, that causes insulin resistance. That's why women in menopause and postmenopause don't tolerate carbohydrates the same way they did. Bone density, cognition, all of those things are affected by hormones. And that's why women, whether you're menstruating or not menstruating, we feel like our hormones are kind of ruling our lives, because they do affect how we show up in the world, whether that be good or bad. And so it's a huge disservice that we're not advocating for women to get more regular hormone testing and getting hormone replacement therapy when they need it.
Well, and it kind of goes back to the principles we already talked about, like not learning about your cycle, not knowing the questions to ask, not having a physician who is aligned with the things that you're experiencing. I can even remember going to, it's funny, I was telling Walter this the other day. We were talking about hormones, and I was like, I went to my PCP, it was 3 years ago. And I was like, hey, I'm just kind of curious. I'm, so-and-so age. I would like to know more about my hormones and how my body works. And I was like, could we run a hormone panel? And she just straight up in the clinic was like, no. And I literally was like,
you're like,
why? Like, I know I'm not a very confrontational person. And so I was just like, okay, well, why? And she was like, well, hormones for women are just so difficult and it's so expensive and your insurance probably wouldn't cover it anyways. And it's just not necessary because you're young. And I was like, okay, thanks for letting me know. And I just left. And it's kind of like you're saying, like, to be able to like advocate for yourself or, that sorts of thing. And so this is a good question too. Going back to optimizing days for working out in menopause or hysterectomy. Are there any good days, or is there ways to know how to push on those days? And I think this could go for whether you're menopause, hysterectomy, or, in a regular training phase, right?
Regular training. So if you're menopausal, you're not having the fluctuations. So you don't necessarily have to pull back or push on certain days, because you're essentially pretty flat in kind of the way that your hormones are produced from the adrenal glands. I will say, though, the unique thing that I transition my patients that are in perimenopause to menopause that we make is that the body, because the adrenal glands take over as the predominant hormone production center, I can almost anticipate how well someone's going to go through menopause is how well they've managed their stress, whether that be psychological or physiological, during their life up to that point. And it's because the easiest way, and this is not a scientific way to explain it, but you guys will get it this way, is your adrenal glands, when it comes to them producing estrogen and progesterone, if they've been pumping out cortisol and adrenaline like that is their job, but like extensively throughout your life because you haven't taken care of yourself very well or haven't managed your stress very well, it's kind of like, screw you, I'm not going to produce a lot of estrogen and progesterone. We're just trying to survive. And so when women are in menopause and postmenopause, your body does not tolerate stress in the same way that it did prior. It doesn't have that same level of resiliency. And we can look at this from a negative connotation, like, the medical world does with everything in relation to women's health is, oh my gosh, this is awful. You won't be the same that you were before. I see it as a huge service for women. And the way that I explain it to my patients is what served you for the first 50 years of your life isn't going to serve you for the next. So this is a great time. And your body is forcing you to reevaluate what's okay and what's not okay in your life and your body. And so it just doesn't like tolerate the same BS. It doesn't like to do it doesn't like to do super low calorie anymore. It doesn't like to do super aggressive workouts. So the biggest thing when you're in menopause, when it comes to training your nutrition, is small changes over time and not pushing yourself beyond your body's capacity all the time. So it's like, okay, we're really focusing on strength training a lot because without a ton of estrogen, your bone density goes down. So we need to protect you from osteopenia and osteoporosis till you're 90. So keep strength training. But maybe don't do 2-hour-long sessions. Maybe do 4-hour-long sessions, during your week. And maybe you used to be a marathon runner and maybe now you become a really good hiker. And the way that you increase the intensity of your workouts is through incline instead of speed or wearing down your joints and your bones in that situation. And so I think it's kind of reevaluating what things are filling, I call it your stress bucket. And if you are, your family is in a really stressful situation, you are battling a different, health condition, maybe it's not the best time to have stressful training and a really low calorie diet to get back to your pre-menopausal weight. But, so I think a lot of times it's really coming at everything from a more balanced, sustainable place, from your nutrition to your training, and finding something that's going to work for you in this time, instead of going, well, this is what I've always done. This is what has always worked. Why is it not working now? Instead of being mean and shameful towards your body, get really curious of what's working for you now. And that's, I think, the best thing that we can do in perimenopause and menopause is, okay, there's been a lot of hormonal shifts and I'm noticing carbs aren't necessarily like my best friend right now, but that doesn't mean I'm going to have no carbs. It just means I'm going to be really strategic and add more protein into my life to help with blood sugar and do less aggressive training from a cardio perspective and focus more on strength and resistance. So I think the biggest thing is checking in with your body on what works for you and are you able to recover? That's the biggest thing. Like, can you recover? Do you feel like were hit by a train an hour after your training session or the next day? Then that was probably too much for your body. And let's check in and do something different. Like maybe you always did CrossFit and now you're doing Pilates. It's not that you can't function anymore. It's just like, this is more plausible and helping my pelvic floor. It just kind of depends on the person. So that's what I would say. I don't know if that made sense, Alex.
Oh, it totally did. And it actually, I was writing some notes here and it kind of brings me to my a next thing I think is really important to talk about, especially with the athlete focus in our community. Mm-hmm. And you mentioned the aspect of not recovering, mm-hmm. which makes me think of overtraining, which mm-hmm. makes me think of injuries, which are this is kind of like where I want to go.
Yeah.
So, in overtraining, not recovering well.
Yeah.
Injuries, right? And being susceptible to injuries throughout your cycle. And then makes me think of, and you can get more into the statistics of this, but knee injuries in adolescent females. Right.
Yeah.
So that's a really interesting thing, which we'll get to. But talk to me about kind of that cycle of overtraining that leads into our cycles with being more susceptible to getting injured.
So when people are overtraining, I think everybody has different capacities, and so it's really hard for, unless you're working with like a specific coach, like yourself, Alex, or that's kind of monitoring your training and having like frequent conversations on, hey, does this feel good? Does that feel good? Instead of, most people are either doing their own, formatting their own training, or using someone's kind of structured training online. And so they're just doing it regardless of how they're feeling and not checking in with their body. And so the best gauge for me is when you're overtraining is if you've noticed you aren't putting on muscle anymore. You're actually cannibalizing your own lean muscle. So it just feels like you're doing all this training, but you're not making any gains from a lean muscle perspective. You feel more tired after your workout, not just like that normal, like, oh, I worked out and I'm kind of tired, but then you get a little bit of an energy after. You feel wiped out for the rest of the day. Or the next day, you feel like you got hit by a bus and you're really sore for 3 to 4 days after. And I see people kind of just think like, no pain, no gain, like work harder, kind of all of these really unhelpful mottos that don't match female physiology on just like, just keep going, like go. And it's like, yeah, that's okay. And I think we can push through, especially as athletes when we need to. But I think if your body's giving you any of those signals, you're overtraining.
Well, and anyone can overtrain. That's the thing.
Anyone can overtrain.
It doesn't matter if you're a CrossFit athlete. It doesn't matter if you just got into fitness. Like anyone can overtrain. And these are symptoms and things that your body is telling you and your brain is telling you, like, hey, we can't keep up with what you're doing. Right.
Exactly. Yeah. And that's such an amazing point, because I just think like, yeah, you can, I'm not an athlete, and I've definitely been a component of overtraining. And the other component of overtraining outside of the gym is, how stressful is your life? A lot of our clientele of patients, I also work for an endocrinologist. She's a physician that specializes in hormones in San Francisco. And so I work with her patients 2 days a week. And in Marin County, there's a lot of go-getter women, right? So that in California, it's like hustle and bustle. And these women are incredible CEOs and moms and wives and doing all of this stuff. And they're doing 2 Peloton workouts a day, and they're training for, they're doing all these other things. And so you have to take into consideration and ask yourself the question, how stressful is the rest of my life? Because your body interprets physiological and psychological stressors the exact same. You might be having marital issues and your body is still interpreting that as, I'm running away from a bear, or fighting a bear, or whatever way you want to say that the sympathetic nervous system is doing. And so it might not be a good time to train for a marathon. You might need to focus more on restorative exercises like yoga or Pilates or walking. And so it's not just what you're doing in the gym and feeling like crap. It's, what does the rest of your life look like? And is this a good time to push your body to its extreme? And at least for me, I grew up being an athlete. And the last 7 years, I've worked full time and got a master's and finishing a Ph.D. and started a company. I've done a lot of different things, and I haven't done any half marathons. I signed up for Alex, you and Walter know that, like, are familiar with Schweitzer Mountain, but I signed up for a mountain race this summer, and I thought, I think I could do it this year. But it's like, I haven't done any races. I haven't done, I love hiking. I do a lot of endurance activities on the weekends, but I don't do any specific training protocol, because I know that my brain and life is asking a lot of me. And so I'm not going to ask myself in the gym to just go kill myself. And I've done that before during my master's. I did that and I looked terrible. I also didn't gain any muscle. If anything, I gained a little bit of fat, and it just wasn't productive. And the more I worked with my menstrual cycle and accounted for all the stressors in my life and what my body is managing at that moment, not just from a workout perspective, but from a life perspective, you get better outcomes. And when you do overtrain, you're 100% right. You're more likely to get injured. And most female athletes get injured 3 days before their period because you have the highest amount of progesterone and the highest amount of estrogen, and it loosens your ligaments. And so your normal kind of detailed movements that you would feel like, oh yeah, like I can totally do a clean. Like you might feel more clumsy during that time. You might feel like your agility is a little off. Like focus on form during those times. Don't try to PR because you will injure yourself because those ligaments are loose. And so I worked with a lacrosse team a couple years ago, and I was like, don't do any, like, be really careful with those side movements, you guys, because your knee's going to go out during that time. But I think having that awareness and being a little bit more, again, it goes back to the education. Okay, I'm leading up to my period. I'm feeling kind of clumsy and off-centered. I'm going to not maybe focus on being the fastest, but I'm going to focus the most on kind of my form and technique right now.
Well, like how much less stressful mentally is that than sitting there and being like, what's wrong with me? I can't do this.
Right?
Gosh, like I've done muscle ups my whole life since I was in the womb. Like,
yeah, I know. And it's like, oh, okay. Like, I don't know if and the more you know more about hormones, like I always find it really funny. It's like, I'll like drop my phone all the time right before my period, or like, yeah, like I'm just like all over the place, or just notice like the funny things that you notice about yourself. Or like for me, it's just, this is personal, but it's like right before my period starts, I like want to clean my house. So I like always know it's like that's like a thing. It's like, okay, we're preparing for new, right? Like, it's like these funny things that you pick up on as women when you know what these hormones can do for you. But yeah, the injury thing is 3 days before, watch that. But just, yeah, the overtraining and then undernourishing. This is a big thing with athletes. Hypothalamic amenorrhea is a big issue in any sort of athletic community, which means that the absence of your menstrual cycle from overtraining. And what that is it's called the female athlete triad. So it's,
called that. I just had this conversation with somebody the other day, and I saw on the internet, it's not called the female athlete triad anymore, but it's called this. Is it still like referred to that?
I still refer to it that way because that's kind of they might have evolved their thought.
No, I'm just kidding.
I was like, I don't know. Now I'm going to look that up, Alex, and I'll let you know if we've evolved from the female athlete triad. But what it is low energy intake, overtraining, and then the absence of your menstrual cycle. And so what you see is, especially as females, then we have to bring in, which you kind of mentioned just like briefly, and I want to speak to it, is like diet culture and kind of the aesthetic of what an athlete should look at it like. And this changes based off of the sport. And so a lot of times women are, yes, you want to eat for performance, but it's like, also, am I going to look good? Like what's my body going to look like? Obviously CrossFitters have a certain, body type, which I love that when CrossFit started becoming more popular, like built this, like women can have muscles and women can look different. And like, yes, thighs are cool. And, like all of this aspect of like really celebrating the female body, but also it's like, I know that there's people that restrict their calories and really watch that and are really focused to try and get that aesthetic, because it's like, oh, I am a CrossFit athlete, so I need to look a certain way, just like gymnasts, just like tennis players, track athletes. Like a lot of times, athletes they're applauded for their performance and their aesthetic. Like they look a certain way. And so if you don't fit that aesthetic, a lot of times the individual will take it into their own hands to try and create that aesthetic. And that's when we see the undernourishment happening, because they're like, well, I don't want to gain weight, so I'm just going to reduce my calories. And then they train a lot. And then it's also kind of like a weird juxtaposition of, oh, I didn't get my period. This is great. I don't even have to deal with that. So it's a little bit of an affirming nature of, oh, my period went away. Like, that's not a big deal. Now I don't even have to worry about that. Instead of like, oh, you could have osteopenia at 22 because you don't have any estrogen.
People think it's normal. So it goes back to that what you said in the beginning, is like, just because it happens often doesn't mean it's normal. And with CrossFit, this was, I would say probably 5 years ago, starting to really be a thing. The sport had been around for 5, 6, 7 years. All of a sudden, there's all these athletes who are, in their late 20s, early 30s. They want to maybe have kids. They want to get pregnant. And then the conversation kind of starts, oh, well, I haven't had a period in 5 years. Oh, well, I haven't had a period in 6. I
Oh
haven't had
my
a period
gosh.
in 3.
Yeah.
And with endurance athletes and like this idea of this growth of social media and the image of the athlete and CrossFit being a very new sport compared to sports in general, you start to have this common theme where it's like, oh, it's normal to do CrossFit at the games level and not have a menses, not have bleeding. And it just could not be further from the truth. And this is where that female athlete triad or triangle comes into play. So if you guys are out there, you girls are out there and you're experiencing this, it's something that is worth your attention. It's something that's worth talking about, you know? And as far as like the birth control argument, then we start getting into, and this might be a tangent, but you can explain this more. The idea of, you know, the reason why a lot of women don't have muscle is because they were on birth control for so long. And that's stating that, but that's in air quotes for audio listeners. You know, is that true? Do athletes who, or younger girls who started birth control forever, who've been on since they were 12 because of acne, is that a thing? Does that contribute to a lesser development of muscle mass? How does that affect the hormones? Because like you said, it makes it into like that early menopause. Like, okay, it's your turn.
Oh no, I think those are number one awesome questions. And I want to, before I get into the birth control, because that is so interesting, because I think about that all the time, is like it's taking away our capacity to be our best selves when you're on birth control. So all these complaints that women have, I'm like, it's the birth control. It's not something else. Like, stop taking your antidepressant. Like, it's from the birth control. But when it comes to the CrossFit athletes and like thinking about, okay, they were so hyper fixated on performance. And then it's like, okay, well, let's focus on fertility. And that's probably one of my favorite things about my job and being like a fertility prenatal researcher and clinician, is that to me, your menstrual cycle is what, and in the medical field, you know, they speak to this as well, as we call it your 5th vital sign. So for me, and that's like an actual medical term, is like your menstrual cycle is your 5th vital sign. You know, we're thinking of like heart rate, blood pressure, all those things. And why it's quoted that is because when it comes to optimization of the human body, reproduction is its lowest on the totem pole. So it's like, if we think about hierarchy of needs, it's like, okay, we need our heart to work. We need our brain to work. Like, we need all these things. And then it's like reproduction. You know, we saw, you know, a lack of pregnancies during famine, or like if your body, the best way I can explain the 5th vital sign, your menstrual cycle and hormones in general, is if your body doesn't feel safe, it's not going to create hormones. It's not going to curate a safe space for your body to think it's a good time to have a baby, because it thinks at that point, whatever stressor it's interpreting, whether internal or external, we need all the resources that we have right now for yourself. We are not going to try and add, you know, we're not trying to then push to, oh, let's have a baby and also need like twice the amount of nutrients and double our blood supply and all these other things. And so to me, it really does a disservice to women to not say like, oh, my period cycle, like my menstrual cycle is gone. There might be something wrong. And then finally, when you're ready, and just thinking about the menstrual cycle from a perspective of fertility, it's from a perspective of health optimization, and whether you want to get pregnant or not get pregnant, it's important either way. You can either track it so you make sure you don't get pregnant, or you can track it to make sure you do get pregnant if you want. And so when you wait till you're, oh, I'm ready to have a baby, I should probably think about my hormones now. That's when it's kind of that part of, then women start to panic because they realize, oh crap, like my whole 20s, I pushed my body to its extreme capacity. And now I have to curate a safe space. And a lot of those things that we have to do to get them back into balance, women don't like. You need to eat more. You need to rest more. I need you to down regulate your training. I need you to do all these things from a more aggressive perspective than we would have needed to in the past, because we have to curate safety in the body for the body to then go, oh, I'm getting enough of all of these things to now have a menstrual cycle, to now ovulate, to now have a baby, essentially. And so it's interesting that you were trying to be proactive. Again, going back to your doctor's appointment, you were trying to be proactive and say, hey, can I get some hormone testing?
Mm-hmm.
And it cracks me up because doctors will say like, oh, well, you're not trying to get pregnant. Why do you want to have hormone testing? And it's like, well, I just kind of want to see where I'm at, because it's important because I'm in my later 20s and I might want to have children in the next 5 to 10 years, like not tomorrow, but like I need to know. And so I think thinking about the menstrual cycle from a place of this is needed for vitality instead of from the perspective of fertility is where we need to go. And so, then when it gets to that point of, oh yeah, I haven't had a menstrual cycle, trying to get it back is really unique and nuanced, and you have to work with a provider to get you there. Going back to your question about the birth control. So it's interesting because just like I said before, just because something's common doesn't mean it's normal. Most girls get put on birth control at like ages 13 to 14 because they have heavy menstrual cycles, they have irregular periods, they're having acne, all these things that naturally come with the onset of menstruation. Mm-hmm. So it's an inconvenient, of course I want, gals to have like not to affect their quality of life, like they can't go to school because they're bleeding through a pad or a tampon every hour. Mm-hmm. But irregular periods within the first 5 years is very common. So we don't need to be putting these gals on birth control at age 13. The other thing is that it takes about a decade for the menstrual cycle to really mature. And so when you're on birth control and you have a period for a year, so you start your period at 12, you have a regular period, still you're 13, your doctor's like, no, we need to put you on birth control. You get on an oral contraceptive for non-contraceptive purposes to regulate your period, but you don't have any, it puts you into a false menopause. And when it comes to the lean muscle mass, athletic performance, and women feeling like they can't put on muscle, estrogen and testosterone are needed for muscle creation. And if you're in a menopausal state, the same way we see menopausal women and postmenopausal women struggling to put on muscle mass is the same reason those gals are having an issue being on birth control and being able to put on muscle mass as well. And so they think, and it's also really hard because a lot of moms don't know this. And so they don't know how to advocate for their daughter. The daughter doesn't know how to advocate for herself. And so it's like, well, birth control seems like the most reasonable solution. Instead of going, well, maybe you have irregular periods because you've only had a period for a year and that's okay. And if it's been missing for more than 6 months, maybe then we can investigate it. But birth control is not going to solve your missing period. Mm-hmm. Birth control is going to give you a false pill bleed instead of actually fixing the problem for your missing period. And so there's a huge lack of muscle mass creation when people are on birth control. That's also one of the main reasons women gain weight while on birth control. And it really varies. There's so many different forms, Alex, of birth control besides just oral contraceptives. There's, they can have a synthetic estrogen and progesterone. They can, the mini pill is really popular right now that just has a little bit of progestins in it. It can be the depot shot. You can have an IUD. There's a whole host of them, but if it's a hormonal contraceptive, it is shutting down your hormones to some capacity, unless it's the hormonal IUD, which does allow you to ovulate after the first year 80% of the time. So you still do get some hormonal fluctuation with the IUD. That's the only one I technically, if someone wants to make sure they don't get pregnant, that's the one I do recommend is the.
Well, and this is a thing, you guys might be bored talking about contraceptives, but it's not just like, I think the big thing to understand is like contraceptives are a thing from when you're 12 to 40, right? And so you have these people who like find CrossFit all of a sudden at 25 and are like, why can't I gain any muscle? Like, why can't I this? And then you have people on the internet who are like, take creatine. Everyone has to take creatine. And like, granted, everyone should take creatine, I think.
But creatine's pretty awesome, to be honest. Yeah.
In case anybody needs it.
Yeah.
But, it's like it. And then you have this information about like one of the questions we get all the time with the ZMT, the sleep supplement, right? Which has things to help at nighttime with production of testosterone naturally. Mm-hmm. We have people slide into the customer service all the time. Well, and it's like, is this product for women? And then we have an article about do women have testosterone? And then it's like, why do women need testosterone? And there's so much of confusion around testosterone being a female hormone as well. And this goes back to what you originally talked about in the beginning. Sorry, I just got like so excited about this because I'm like,
no,
so
you're good.
hard,
I'm here for the women with testosterone. Yeah.
But I mean, this conversation just comes up all the time. So it goes back to what you said about research. Hormones are typically not researched in women because of the variables. And in science, we don't always know how to control variables. And the less variables we have as scientists, the better. Right? To see more or less. To test a hypothesis and not have to test it 40 times. But with testosterone specifically, it has not been researched in women, which is why it is fully dubbed as this, testosterone is a male hormone. Yeah, they have more of it, right? But can you explain to me and to our viewers and listeners, what is going on with testosterone in the female body? What is happening? How do we use it? How do we, use it to build muscle and recover and sleep better? Where does it come up during our cycle?
That's a great question. Also, one of my number one favorite fun facts about hormones is women actually have more testosterone in their body than they do estrogen. And so even though we commonly think of estrogen as the most dominant that's our female hormone, testosterone's the male hormone, estrogen's the female hormone. If males didn't have estrogen, they wouldn't be able, they literally would be dead, literally, but they also wouldn't be able to put on. That's why when you just give a man testosterone or do TRT, they need estrogen. They need estrogen. We need testosterone too. Testosterone doesn't do a huge fluctuation during the menstrual cycle. We see a little bit of more of a peak around ovulation because it helps a lot with libido. So if you have a low sex drive, typically it's from low testosterone. And low testosterone is, caused by a whole multitude of downregulating all of those hormone production. So it could be from hormonal birth control. It could be, from all different sorts of things as well. That's probably the biggest one that I see kind of affecting testosterone besides age. As we get older, testosterone starts to go down. And that's another thing that affects sleep, lean muscle mass creation, and all of that kind of in general. So testosterone, we do see it lower in women these days, but we're also seeing too much testosterone. So it's about having that perfect balance. So I've seen this a lot in the CrossFit community. A lot of the women, I'm just hypothesizing, have body types that look like they have more testosterone than average women. And that may be correct. So one of the main hormonal conditions that women are typically dealing with is something called polycystic ovarian syndrome, or PCOS, which you have more androgens and higher levels of testosterone, which makes us hold on to more muscle mass, and we're stronger than typical women. So, and that also comes with typically irregular menstrual cycles as well. And so I have this hypothesis with a lot of women in the CrossFit community is that they have irregular menstrual cycles because a lot of them have PCOS and have elevated testosterone levels and are stronger than the average female, which is great and makes them excellent at that sport. So we can really use it to the advantage, but we don't see a huge fluctuation. I would say just a peak right before ovulation with testosterone, and women do need it. We need it for cardiovascular function. We need it for brain function. We need it for fertility. And one of the best ways that I love optimizing testosterone in women without any sort of hormone replacement therapy is optimizing zinc and selenium in their bodies. So zinc helps a lot with testosterone production in both women and men. And so we use that a lot to help support women with too much testosterone, women with not enough testosterone. I always use it in I don't have any male patients anymore, but if my fertility patients have their husbands typically come in with them and their partners, and I usually will always put men on zinc and vitamin D to help optimize their testosterone levels as well, to make sure the quality of their sperm is high. And so zinc is one of my favorite things to optimize testosterone and vitamin D in both women and men. So I think, and you can also increase your testosterone amount for women and men by putting on more muscle mass too. So it helps build muscle, but also having more muscle mass will help with testosterone levels in general. I think did that answer your question, Alex?
Yeah.
Okay.
Yeah. I mean, and it's like, when it seems so easy to comprehend, but an application not, like when your hormones are running well, you feel well, right? Like you should, and when you talk about this, I don't get into like the nitty gritty with it, but typically with like nutrition or training clients, it's like you should have a happy period. You should have a happy PMS. Like you should not feel like your world is ending, and then
totally.
as far as building muscle mass and things like that. And it's like, if you can reduce the variables and collect the data and understand how your specific body works, using that to your advantage, and avoiding injury and just like not getting dirty or not, eating food. I mean, people like to eat food. It's nice to eat food and not feel like you're
I love food. Yeah. Well, and I think the other thing, Alex, is one of the best ways to self-advocate is just start tracking your cycle. There's so many great apps because you might not know, oh yeah, the week before my period, I always feel really sluggish and my training sucks, but you've never correlated that because you've just, haven't correlated that. So I love the Flow app. I love Natural Cycles. Like there's so many you could use any of them, and tracking the symptoms to see what your normal is, and then communicating that to your physician from a really educated standpoint on every single month. I have debilitating cramps 3 to 4 days before. I also go through, 10 tampons a day. Like I'm having tons of heavy bleeding, but you don't know, you can't self-advocate for yourself if you don't know about yourself. So you can't, everybody's really nuanced with that. And so everybody's normal is going to look a little bit different, but exactly like you said, like happy cycles, like happy individuals with that. And so I think, but if you don't even know what your normal is, and then you're going to be going in, if you need to get support, kind of unprepared, and then feel like you get stuck in that, like, well, can I get my hormones tested? And they're like, no. And then you're like, well, I have all this data. Like, this is what I have all this data.
I was like, okay, thanks. Bye. Okay,
I'm very non-confrontational too. And sometimes I've gone to so just to give you like permission that's okay. I've gone to the doctor before and they've like told me something and I'm like over here, like almost have a PhD. I'm like, yeah, you're right. And I like leave and I'm like, what? No. No. But I think tracking, like getting informed on your own body, because you have to know what your normal is to know if that's not okay. Like, and then, okay, everything's happy, it's just going well. And then 1 month, your period is 37 days, like your cycle is 37 days long. And instead of freaking out that you're pregnant, maybe go, oh, well, I was really stressed out, or I didn't have signs of ovulation this month. Like I didn't have any cervical fluid. I didn't notice any like shift in my libido. Like nothing. So I think watching all through your cycle, not just leading up to your period, is really beneficial, especially that ovulation time, because that's the main hormone time of your cycle. That's how we create our hormones, is ovulation. And so if you're not ovulating, you're not producing hormones, and ovulation will stop if the body feels stress or taxed.
Well, and you're also keeping like that power. And this is, I think, a big one, especially in like mental health, and like giving your power away to others. Right. And so like, this is an interesting thing too, where you can take your power over your body back. It's not like, it's your fault I'm this and it's your fault I'm that. Like, well, if you don't know and you're trusting someone else, then is that power really in your pocket? Right. And so
100%.
This kind of made me start thinking though. So in CrossFit, there is a whole new generation of athletes. And this generation of athletes is younger women. This year we have 2 athletes who, in last year and the year before, and not 2, but these athletes who are coming in at 16, 17, going to the CrossFit Games as an individual female. They are stacked, they're at the top of the leaderboard. And what do you feel like, with so much education and so much knowledge about the female body? Typically, we think female athletes are peaking in the sport between 27 and 32, right? All
Mm.
of a sudden, the top of the leaderboard has a 17-year-old, has an 18-year-old, 19. So what does that do to an athlete's longevity? What can
Mm.
younger female athletes who start this intense training, I mean, it's like Olympic level at 17, right? And
Yeah.
we see this in other sports like gymnastics and ice skating,
Yeah.
swimming. But for the CrossFit athlete who's a hybrid between endurance and strength, what can prolong the longevity of them as an athlete to avoid injury, overtraining, the triad, that sorts of thing? Or do you think it's different at all? I mean,
So I think we might be seeing, that's super fascinating that you say that, because we're seeing, due to kind of environmental influences, girls starting their periods earlier. So now we're seeing girls starting their periods around 7 and 8, where it used to be the average around like 10 to 12, closer to 12. So I think we're seeing a natural progression of hormonal influences from environmental factors, whether that be plastics, xenoestrogens, and different things, starting the menstrual kind of process earlier. Therefore, we're seeing women peaking earlier in sports. Does that make sense? So I think that from a physiological standpoint could be one of them. It could be that we just have a group of badass women that are coming up that we're really empowered and we're like, I'm going to just do this. But I think the influence of that intensive of training, you have to really start thinking of the longevity of that fifth vital sign from the beginning of your training. Because I think at 16 and 17, we don't even have full development of our prefrontal cortex, which is, all of our decision making and all of, kind of that emotional intelligence. And so we might be more likely to push ourselves beyond our natural athletic abilities to go like, well, I feel, and also that's the framework from a psychological standpoint, that they're in their invincibility complex. And so they feel like nothing can touch them. That's why teenagers will engage in high risk behaviors, because they have this invincibility complex. And so I think we can work that to their advantage as long as they have good coaches and trainers that are there holding the parameters for them to push appropriately within that. But it's thinking of them not as just an athlete for, between 16 and 25 now, but how do you want to move when you're 70? And I think, to me, like, that's how we start thinking. Like, I just turned 32. Like, I'm like, okay, like, I want to keep hiking mountains till I'm 60. Like, what does that look like from a training perspective? And I think also talking to the gals about like, okay, at this time, we're going to push your training. This is not sustainable. We are going to push the limits of your training right now. But in the off season, we're going to do something different and really cycling their training at an appropriate rate. The biggest thing is them consuming enough calories for the amount of training that's required for a CrossFit athlete. And so most girls are under eating. They're under eating carbohydrates and they're under eating protein. And so during that phase, 16 to 17 to 18, they're still growing height wise. And so most of the time, the CrossFit athletes that were really winning 27 to 32, we're done growing. Like, we're done. We're not getting any. At least I keep wondering if I'm going to get taller. I'm not. And so, yeah, this is like 5'5" people. We're just hanging out here. But they're still growing. Their bone structure is still developing. Our bone structure is still developing till we're 30. And so we need to make sure, okay, the nutrient density of their diet, are they getting enough calcium? Are they getting enough vitamin D? Are they getting enough magnesium? Are they eating enough protein to develop this lean muscle and help replace the breakdown of their muscle that happened during their training, with their amino acids? Like, do they need branched chain amino acids? Are they eating something with it 30 minutes to 60 minutes of training that's high protein to replenish the integrity of the muscle mass that was broken down? Like, are they eating enough in general? What's their glycogen storage look like? Are they consuming enough carbohydrates? So I think it's making sure that they're eating enough protein, and eating enough nutrient dense foods that are going to have the minerals and the nutrients that they need to continue growing while they're performing. And that's the uniqueness of this age group, is that they're still growing. And so we have to make sure that someone is, yes, let's push them, you know, they're crushing it out there in the games. That's awesome. I love that for them. But I also want them to make sure that they're not compromising their long-term health for short-term performance gains. And if they are, they're doing that with the understanding of what they're doing, right? Like professional athletes, they all know they're killing their body. That's why they make, you know, it's like they're making all this money and it's like, okay, well, we're going to push ourselves to injury because this is my job. But I think they understand that. I don't know if a 16 or 17-year-old understands that. And so it's having really good coaches that are trying to maintain the integrity of their health during that time while still letting them perform and optimize if they're doing awesome, you know, if they're performing really well, like let them do that with enough kind of safety barriers in there that they're not going to compromise their long-term health.
And kind of going back to the idea that like CrossFit is a newer sport.
Yeah.
Because it is, but they don't, I don't know why I keep air quoting anything. But like there's not that pool of experiences or athletes quite yet, right? Like you think about like what you just said about killing themselves, like a average lifetime career of a football player is 2 years. The injury rate is 5%. They understand that. You know, and then getting into bodybuilding, like taking hormones and like serious hormone, you know, testosterone, growth hormone and things like that. They understand they're putting their body at a risk to pursue the sport. You know what I mean? And there's consequences to that. And we see bodybuilders dying earlier. And like, this is a little bit of a tangent, but that's kind of why I asked you, you know, about these younger athletes or even athletes in their 20s, or how we're seeing the rise of the masters athlete in CrossFit. That's another really cool thing. You know, I've worked with games athletes who are 23. I've worked with games athletes who are 55. And it's very fun to see how different it is and how kind of going back to that earlier question about menopause, you know, like some of my older masters, female athletes, they're like, it's so nice to be able to train like a man because I'm not fluctuating throughout the month as much.
Right. You really can train like, I mean, that is so true. You can train like a guy. You're not fluctuating. You can just optimize that. And I think it's just embracing the season that you're in and being able to be okay with that, you know? And, yeah, it's pretty incredible to see like younger girls kind of grow, but I just don't want them to compromise. They are not thinking about their fertility. So their coaches and their trainers need to be thinking about what are we doing within this to help them have the broader scope of holding that potential for them when they're 30 and they might want to be a mom while still engaging in the training to make them perform really well as a 17-year-old. And I think you can hold both.
Totally.
I know you can.
Yeah, you absolutely can. And it's worth the time and investment into learning that. And, you know, I have this question or this revolving conversation really similar to what you're saying with athletes that we bring in on the supplement side of things, where it's like, you know, with Swolverine, we don't want athletes to just be good for the now. We don't want you to just be great. We want you to be great for however long you want to be an athlete. And that, you know, supplementation, a lot of times with our younger athletes are people who are coming in, they don't see the point in it and they don't see any value in it. And
like, what do you mean? Like,
it's like kind of those considerations that the invincibility complex. I love that. That's actually going to be fun to look into a little bit more.
It's fascinating. My college students, they're like, well, why do I need to care about heart disease? I'm not going to have a heart attack. I was like, now, but you will in 20 years. And what you're doing right now will build into potentially having a heart attack at 45 versus 50, you know? And so it's that understanding of what we do. And we're in a here and now and instant gratification culture. And I think what I've seen being in the health and wellness industry and being in the medical profession for a decade now is that these easy fixes, it's all about sustainability. It's like, what can you walk 2 miles a day for the rest of your life? You will be incredible if you could do that, you know, instead of like, well, I'm going to go do, you know, people are really hot on training stuff for 4 weeks and then they like sit on the couch for 6 and it's all just about consistency. And that's what the female body responds to really well is consistency with the understanding that there's going to be fluctuations through the month of what consistency looks like for them.
Yeah. Yeah. And, it's the basics, and for like our CrossFitters who are listening, Mal O'Brien, everyone was watching Mal O'Brien right now. And I think the best part about that you can pull from this podcast and apply to an athlete like that, who's pioneering the sport for the future of the sport, is that she takes this invisibility complex and like, you just watch her face doesn't change, her composure doesn't change. And she crushes the workout 2 times as fast as a male does, and it's like, well, she's not even there. Well, no, that's where you can use that type of complex to a positive, but she also is under the guidance of a coaching team, with Matt Frazier, that takes into consideration all of the micros, all of the macros, all of that type of support. And it's like, that's the extreme, and that's a really nice model to have. But if we take that 10 steps back and apply that to Alex, or we apply that to Karmen, or we apply that to you, the listener, how can your body already works on a routine. Right? Your cycle is pretty routine, and everything else in your life is variables. And so it's like using that as your anchor point to create consistency, to reduce variables, to collect the data, to optimize your life, to optimize your athletic potential, to optimize how you treat other people, or how you get pregnant, or if you can do these things, and can you do them to the best of your ability. And there's like this quote that, floats around on Pinterest all the time. And it's like, what a shame it is to not, and I'm going to butcher the quote, but this is my own quote of it, but it's like, what a shame it is to go your entire life and not know what your body is capable of. These vessels that we have they're magnificent. They're phenomenal things that we can harness and really apply in what we choose to be, is a positive or a negative way. Right. And someone, like Karmen, you're out there saying like, hey, we want to provide a place for you. Like at Selkirk, you're saying like, these are the things that I've experienced. These are the things my colleagues experience. I've researched these things, and I want to create a place for people to do that. And in learning more about yourself, you can advocate for yourself, and you can find people like Karmen, and you can find people who aren't going to say no to you and say, you're just a woman, or you're just this, or there's something wrong with you, or stop asking questions you don't need to know. And that's like the worst thing that can happen. Right.
Well, to just be shut down. And I think that's what so many women, whether you started your menstrual cycle, you're trying to get pregnant, you're perimenopausal, and you're having lots of, like it happens in all the different places of a woman's life. And what I try and what I want to encourage the listeners to do is remember your doctor works for you. And if they're not listening, fire them. Like go find another doctor. And so because there is, and you might have to do specialty care, like, we're a cash pay practice. We don't bill insurance because I don't want to be held by the insurance model. I want to do what's best for my patient, not what the insurance company tells me they're going to pay for. And so go find a provider. There's lots of really incredible kind of, I call them grassroots providers like myself and Jordan that you help. You're there to help the patient. And we have our practice is growing substantially, but it's like the integrity of taking care of the patient is the number one ethic that our company was grounded on. And I don't see more than 7 patients a day. The average physician sees 35. I spend an hour with every patient. The average physician spends 10 minutes. So it's like, are you going to have someone that your physician should be on your team, and you shouldn't have to try and convince them that you have a problem. Like they should be wanting to know. And so find someone that listens, and don't stop until you do. And there's so many cool things that are popping up in medicine right now where it's like, you can order your own labs. You might not know how to interpret them, but like you could find someone that does, or, there's so many advances that are coming to the forefront. And women's health, like we are in our era. Like it is coming to women are done being told by male doctors that we don't know what we're talking about when it comes to our bodies. And so I think this is a great time for women to really step up and say, this is not okay. And I'm going to go find someone that will listen. And there's so many different physicians that you can have on. One of the benefits of COVID is we do medicine from anywhere. Like you can see a physician that you love in New York, as long as they are have licensure in your state, but like, it just kind of depends. But I mean, it just is so cool that you can find someone that matches with you. It's like lots of patients will resonate with me, versus someone else. But if they don't, that's totally okay. Like they'll find someone that works with them. But I think they have to be a partner. They have to be your teammate, because they're on your medical team, and you want someone that, I mean, our patients text us. How often do you get to text your doctor? Like, it's a service that we provide because we're committed to patient care over, just trying to turn another dollar or get, 20 people in the door every day. And because that's what I would want. That's what I wanted. And that didn't necessarily exist in our community to the capacity that I wanted to. And so I think that if women are getting frustrated, there is other people. Like I want to say we're unique in our own way, but it's like we're not unique in the sense that we're the only ones that are doing this. There's lots of grassroots providers that will listen to you and provide you with the care that you want.
Totally. And making that investment, and also making like that mental investment, that if like financially, maybe that's a goal of yours, is to be able to do, kind of boutique healthcare or boutique supplements, right? Like, so we run into this too in our own way, or with coaching. Oh, I can't afford it. Oh, I can't do this. We'll read, find companies that you trust, find companies, doctors that you can, consult or follow their pages, right? Like Selkirk Women's Health. You guys like go follow them on Instagram. It's SELKIRK Women's Health. Karmen's on there. Our partners are on there. At Swolverine, like we tell people who are like, hey, I can't afford your product yet. And I'm like, great, you're not out of options. You don't need a product to fix you. Read the blog.
Yeah, your guys' blog is awesome. It's like all science-based. We're in the information era. You don't have to have a PhD to be able to facilitate really appropriate healthcare. Like, your body well enough, and then read articles and see what resonates with you and get really curious. Like, so
also, like, be careful who, and be wary of who you follow. So on this same flip side of that coin, if you're following influencers for hormone health, if you're following influencers who are, doing a lot of restriction, if you're following the direction of a coach or a doctor and you feel like something is off, it probably is. It's okay to trust your gut. It's okay to ask questions. And if they say don't ask questions, and they say don't, you don't get to know, go somewhere else, So,
well, and check their credentials. And my favorite thing to tell my patients is, I don't know, but I'm willing to figure it out. If someone says they don't know, they probably know a lot. Like they know the limitations of their own knowledge and the limitations of the scientific literature. And so they're willing to put their ego aside to do what's best for you. And I love when I hear other PhDs say, I don't know. Cause it's like, well, that's the expert in the world that just said they don't know. And to me, I'm like, yes, that I want to trust that person. So.
Yeah, absolutely. So are you guys doing telehealth still?
We still do telehealth. So Jordan can only see patients in Washington and Idaho, because that's what she has licensure for. I can see patients for nutrition. We can't order any lab testing outside of the state, but I can see clients, I guess I would call them clients instead of patients if they're out of the state, for nutrition and prenatal and fertility. And so we do more besides just nutrition. I'll advise on nutraceuticals. We can help, interpret your labs for you, but we're bound a little bit tighter in scope if you're out of state.
Cool. So how do people do they go to the website? Do they go message you guys on Instagram? Like, how do people find you in a professional sense?
I know. I always feel like sometimes my patients are like, you're kind of hard to find. I'm like, oh, are we being inconspicuous there? You can DM us on Instagram. You can go to our website, which is Selkirk Women's Health, same as our handle, and do a free discovery call if you want to talk. Me and Jordan, we're a 2-women show still. And so we do all the new patient calls, so you can talk to us and see if it's a good fit or not. And that's free. We, spend 15 minutes with you, and you can kind of check and see. We've got some blog posts up, but keep in mind we're 5 months old. So with that, so those are probably the 2 best ways to find us, is our website and our Instagram, is what I would say. Yeah.
Okay. Oh my gosh. What an awesome episode. And thank you guys for chiming in with the comments. Thank you for watching and listening. Make sure to subscribe to the Swole Friends podcast. We do live recordings of each episode on YouTube. We post all of the audio to Spotify, Apple Podcasts, as well as a few others. Wherever you can find podcasts, you should pretty much be able to find the Swole Friends podcast. Karmen, thank you so much for your time. You guys make sure to go follow Selkirk Women's Health, visit the blog, sign up for a consult with Karmen and her partner Jordan. If you guys are seeking, any type of assistance with hormones, pre and post, if you need directions on reading those labs or getting nutritional recommendations, she's an incredible wealth of knowledge, as she just proved over the last hour and a half. So Karmen, thank you so much for joining us. And you guys, thanks for listening. And we'll see you all next time.
Thanks, Alex.